So here at Central Valley Network, we have our residency programs that are located in Hanford and now Tulare.
The residency program is all about hands-on experience. I see the residents as my junior colleagues, and when we're seeing patients together in the office or in the hospital or in the newborn nursery, we're going to be side by side seeing patients. The residency program is really an outgrowth of the vision and mission of Adventist health system. They have really sought to seek out communities that need health care to provide wellness and hope and good health, increasing access, decreasing costs, and all the things that sound terrific, but are really meant in a very heartfelt way.
What these opportunities will enable them to be clinically competent and have experiences that they will one day be practicing on their own. The unique thing to the Central Valley Network is we have over 40 rural health clinics, and we have our 4 hospitals that are in our network. So we have Hanford, Tulare, Selma, and Reedley. And the experiences for the residents are throughout all the hospitals and also the clinic system. And what that allows the residents to do is to have experiences and clinical opportunities with different settings and different age groups. And it also gives you the opportunity to look at rural health, urban clinics, private operating clinics, a good array of the opportunities that I think residents need through their years of training.
We are an unopposed program, so the residents, when they're around the specialists, they're going to be the only residents at that time, so they're not going to have to compete for exposure. They're going to be first in line for any procedures or any teaching opportunities from any specialist. They're going to do the full gambit of rotations, so they're going to be working with dermatologists, cardiologists, surgeons, doing outpatient procedures, as well as assisting for any of their patients that go into the OR in the hospital side.
One of the most appealing things about this area is the area itself. It is a beautiful area with great climate that is conducive to having outdoor activities year-round. You're less than half an hour to the front of the National Sequoia Forest, and you could take a day trip to the beach if you want. You could hike all kinds of trails in the mountain.
Quality of living, I think, is a lot better. Crime's a lot lower than it would be like in a big city. And you get to know your patients, you see them around town. You have a more of a feel of comfort with them than you would, I think, in a bigger city.
This program will allow the residents to be embedded in the community. They live here, they work here, they train here. A lot of them have gone on and married here. They've grown roots here. And so I think for somebody looking for a program that will allow you to take advantage and have different experiences in your training, I think this is a place to do it. This organization is faith-based, and the mission is to live God's love.
If it is something that appeals to you, it is something that will definitely deepen your own faith and allow you to connect to patients in your practice in a way that maybe you wouldn't be able to do if you were in another organization. And it would even be welcome for you to pray with your patients. And I want anybody who's interested in this program to know that if they come to this program, I'm going to devote all of my resources to making sure that they can get from being a medical student to being a competent physician. And during the time that they're here learning, they're going to feel respected, they're going to feel excited and challenged, but they're always going to know that it's a safe place to ask questions and become a better physician.